discuss about nasal polypi. So polypi is plural. Okay, nasal polypi. So what are these polypi? These are mucosal masses. Okay, when the mucus get swelling, means swelling of the mucus is known as polyp. Okay, these are not cancers. Okay, these are non-neoplastic masses of edematous nasal or sinus mucosa. So these are divided into two varieties. One is Antro Choanal Polyp and another one is bilateral ethmoidal polyp. Antro means maxillary antrum, choanal means nasopharynx, so polyp. So first you need to have an idea of lateral wall of the nose and the sinuses present. Okay, in the lateral wall of the nose we have superior turbinate, superior meatus, middle turbinate, middle meatus, inferior turbinate and inferior meatus, and this like medial to the middle meatus we have groups. They are divided by the basal lamina into anterior ethmoidal group and posterior ethmoidal group. Those are ethmoidal sinuses. Okay, so and this antrum is of maxillary near the maxillary sinus. For the there is a opening which is known as antrum. So here it is known as Antro Choanal Polyp and bilateral ethmoidal polyps are the two different varieties of the polyps. Coming to the Antro Choanal Polyp, we will call this polyp as Killian polyp also. As we saw, this is had already we see that this polyp arises from the mucosa, right? So we are saying Antro Choanal Polyp. So this must be arising from the mucosa of the maxillary antrum. Okay, from the accessory ostium. Normally ostia which is present, this opening will be opening of the maxillary antrum will be present in the hiatus semilunaris, which is present in the middle meatus. Okay, if there is any accessory ostium present, then from the accessory ostium this polyp may arise. Okay, so then from the accessory ostium the polyp will comes out and it enters into the choana, means nasopharynx, and then the nasal cavity. So it looks like a dumbbell shaped polyp. Okay, it is globular polyp. So it has three parts. As we said, it is antrochoanal polyp. One is antral part, which has a thin stalk, choanal part which is round and globular, and third one is nasal part which is flat from side to side. Coming to etiology, so what causes this antrochoanal polyp? One is nasal allergy with sinus infection. Infection should be there. So then only this polyp arises. Most common antrochoanal. In choanal word there is ch, no, so it occurs in the children and young adults. It is single and unilateral. Okay, so symptoms will be unilateral nasal obstruction, which may turn into bilateral. Okay, voice will be thick voice, hyponasal voice is seen. Nasal discharge will be mucoid discharge. Okay, coming to signs. Through anterior rhinoscopy, if the polyp is present posteriorly, we can't observe, we can't appreciate the polyp present. So through anterior rhinoscopy, what can we see means a large polyp which is smooth grayish mass which is covered with nasal discharge, that is mucoid discharge in the anterior rhinoscopy. So and it is like its consistency is soft. So with probe it can be easily moved up and down with the probe. Okay, large polyp will be protruded from the nostril. Okay, so exposed part of the polyp looks like pinkish and congested look it presents with. So coming to posterior rhinoscopy, okay, posterior rhinoscopy will appreciate the globular mass which is filling the choana or the nasopharynx. Large polyp behind the soft palate, it may enter into the oropharynx. This can also be appreciated through posterior rhinoscopy. Okay, polyp which is present behind the soft palate and which enters into the oropharynx can also appreciated through the posterior rhinoscopy, which can't be seen under the anterior rhinoscopy. So we have to do both anterior and posterior rhinoscopy in case of polyps. Okay, endoscopic examination, choanal or AC polyp posteriorly in the nasal cavity if it is present, so we should do endoscopic examinations also. Okay, coming to the differential diagnosis of the polyps. One is we are telling that edematous mucus is polyp, right? It is non-neoplastic mass and edematous swelling of the mucus. So mucus blob. So how can we differentiate the mucus blob from the this polyp? Means when we ask the patient to blow the air forcefully, then the mucus blob will get disappear, but polyp won't get disappear. And hypertrophied middle turbinate, is any hypertrophy in the middle turbinate will present as should be differentiated from the polyp. Okay, angiofibroma, as you see angio, there will be blood supply, it appears as a pinkish mass. Okay, and it is firm in consistency, whereas our polyp is soft in consistency. In case of angiofibroma, pinkish appearance with firm consistency you will appreciate. In case of hypertrophied middle turbinate, you will appreciate the hard consistency. And our antro choanal polyp should be differentiated from the other neoplasms of the maxillary sinus. Okay, or any other part of the nose. So X-ray paranasal sinus, you will appreciate the opacity, opaque. Okay, in the involved antrum. X-ray lateral view if you do, will see air column behind the polyp. So if you see air column behind the polyp, we can differentiate the AC polyp from the adenoids and angiofibroma. Okay, there will be no air column in case of adenoids and uh, this angiofibroma. Okay, non-contrast CT scan of the PNS is gold standard. Okay, uh, treatment, what is the treatment of AC polyp? It is endoscopic sinus surgery. Okay, FES. And AC polyp should be removed through avulsion. Recurrence, in case of any recurrence, we will do Calvel loop operation. Okay, Cardwell loop operation. If Cardwell loop operation complication is oropharynx, complications will be there. So that's all for today. I hope you understood this anterochoidal polyp. Thank you guys.